Good morning, everyone. Thank you for joining our webinar this morning on our update on coronavirus. This is part 10 of our weekly updates. The next one that we will do, we're not sure whether we're going to do on next week or the week after, so please look out in your email boxes for an invite. I think we're going to see what guidance we get from the government this week as to when's best to do an updated webinar. A bit of housekeeping for those that have not joined our webinar before. So this is a broadcast. So unfortunately, we're unable to hear your audio. I will show you shortly how you can ask a question on the webinar. Hopefully you can see my screen now. And in terms of timing, this is booked in for half an hour. We normally finish up around the half an hour mark. Sometimes it goes over slightly depending on the questions that we get at the end. And we are going to save a bit of time at the end for a live Q&A. So any questions you do have, put them in the questions box, which I'll show you how to do shortly. In terms of presenters today, we've got Michelle Hobson. She is our HR Services Director. We've got Audrey Robertson. She heads up our HR consultancy team. And we've got Philip Barker, who heads up our health and safety team. And they're going to walk us through the content today and also answer any questions that you've got throughout the webinar. So in terms of agenda, what we've got planned today is to go through what's new. Obviously, we've had some new guidance come through over the last few days from the government. So we're going to talk to you around what's new and what employees need to be looking out for. We're going to look into health and safety, so protecting your workers, helping them get back into the office environment if that is what you're looking at doing. And then we've got how we can support you. We've got some information around a consultancy package that we've got to support businesses. And then we're going to go to a live Q&A. So I mentioned before about asking questions. On the GoToWebinar control panel, there is a question box. This is how it comes through to us. Any questions that you do ask, I'm not going to say who's asked them. I'm just going to ask the question, hopefully get them answered. Any questions that we don't get round to answering, because we do get quite a lot on the webinars, or there are any that we're unable to answer for whatever reason, we will come back to you separately after the webinar with an answer. So with that done, I'm going to hand over now to Michelle, who's going to take us through the current stats and advice. So over to you, Michelle.
Thank you, Dan. If you just go on to the next slide. Just to kind of review where we are in terms of stats. Sorry, that date's wrong. That was as of Monday, the 11th of May. There's been just over 223,000 confirmed cases and just over 32,000 deaths. The risk to the UK is still remaining at high, but the things sort of note about these stats at the moment is that data now includes deaths outside of hospital, so we're showing a more realistic view. The information that you see published daily by the government gives cases in hospital and out of hospital where there has been a positive test for COVID that has contributed to their deaths, but there are other statistics that are appearing all the time, and this morning is due out the Office of National Statistics update, which includes all deaths where COVID is mentioned on the death certificate, even where it was suspected and there wasn't a positive test, and that's registered by the date of death and shown by the date of death rather than by the date that the government found out about it. So you'll see different sorts of stats, but I think the one thing to note though is that we are on that downward trend, that downward slope, and we're still pointing to the fact that the peak happened around the 8th of April. Now coming down is taking a lot longer than going up did, but I think it is good to see that trend, and it's obviously that trend that the government is seeing which has prompted the latest updates that happened over the weekend. So if you just go into the next slide, we have got quite a lot to get through today, as you can imagine, after this weekend statement. So we'll try and get through as much as we can, but giving you the right amount of information. So from the 10th of May then, the new advice by the government is stay alert. And it comes with 6 main areas. Stay at home as much as possible. Work from home if you can. Limit contact with other people. Keep your distance if you do go out, and this is 2 meters apart. Washing your hands regularly, and continuing to self-isolate if you or anyone in your household has symptoms. And we mustn't lose sight of the fact that the guidance and advice that was there at the beginning around self-isolation, if any of you had symptoms, still remains today and is still key to controlling this virus. So obviously we know that the main statement from the UK government is now stay alert rather than stay at home. But it's important to note that Scotland, Wales and Northern Ireland are still using the stay home at the moment. So there is variances within the countries in the United Kingdom at the moment. So on to the next slide then. The next three just take you through a really high level of what is new. And this is taken from the government plan that they released yesterday. So this was the backup to Boris Johnson's statement on Sunday and laid out the different phases. Now it's a 60-page document and I've put the link on there. And this is called the Plan to Rebuild. So it's the UK's COVID recovery strategy. What I've tried to do over the next 3 slides is from the 3 steps that they've given guidance on potential dates, pick out the ones that are most important to work. Obviously, there's lots of other things around sport, exercise, potential social bubbles, etc., but this is really focused on work. So step 1 from Wednesday, the 13th of May, it says, for the foreseeable future, workers should continue to work from home rather than their normal physical workplace wherever possible. So that hasn't changed, that piece of advice. If you are working from home and you can continue to working from home, you should do so. Any workers who cannot work from home should travel to their workplace if it is open. And as soon as is practically possible, workplaces should be following the new COVID-19 secure guidelines, which is about helping businesses open in a safe way that makes it okay for their employees and reducing the risk of transmission of the virus. And then one thing that is quite new, which I know Phil will touch on later, is that as people return to work, the government are now advising people that they should aim to wear a face covering when they are in enclosed spaces where social distance is not always possible. So this, for example, is on public transport or in some shops. And there may be certain workplaces where it is determined that it should be advisable to wear face coverings. Now, as I said again, Phil will talk a bit more about this later on, but the use of the word face covering is very important. They are not talking about face masks, which is very much from a clinical point of view. That type of PPE should be left for the people who need it. This is talking about face coverings, and these can be homemade. So on to the next slide then, which talks about step 2. And step 2 is said to be no earlier than the 1st of June. And the government has started talking about a phased return for early years settings and some schools. So this covered nurseries, mainly reception year 1, year 6. And that they will start to phase it. Obviously, this is important from a work perspective because there's the chicken and egg situation, which would make it very difficult for parents who have their children at home to go back to work if there are no school or childcare providers opening. They are also planning that from the 1st of June that we may be able to open non-essential retail outlets, and they will start thinking about permitting cultural and sporting events. Now, these will still take place behind closed doors, but again, this means a movement in terms of the economy and the people who work in these industries. And this will all lead to the reopening of more local public transport in urban areas, but subject to strict measures. And then finally, step 3, which is said to be no earlier than the 4th of July. The statement is that they will then open at least some of the remaining businesses and premises that have been required to close. So this includes personal care, such as beauty salons, hairdressers, hospitality, such as food service providers, pubs and accommodation, public places like places of worship and leisure facilities. But again, they've been very clear that this will happen in a phased approach and will be subject to quite strict guidelines. But as we get close to that date, we'll imagine that we'll see more information about what that will look like. And the biggest dependency on all these factors is this R rate that Boris Johnson was talking about, the rate of infection. It's keeping that below 1. And as we are taking these baby steps back out into something that might look a little bit like normality, that rate will be very seriously monitored and adjustments will be made, which is why all these dates are provisional. So as I said, lots of information in that 60-page document, but we thought it was important to frame today's conversation by talking about it at a high level and giving you an idea of the plans going forward. But now I'm going to go on to Phil to talk in a bit more detail about the health and safety impacts of this. So over to you, Phil.
Thank you, Michelle. I don't know if there's anybody else who, when they saw the Prime Minister's statement on Sunday, sort of heart sank and sort of he's suggesting people go back to work this week, and we probably haven't got risk assessments in place to make sure that we can do that safely. So obviously, I just thought there'd be a nice, this slide just a reminder that employers have a legal duty to risk assess the hazards in the workplace and to review those risk assessments when something changes. The coronavirus, the COVID-19 variant, or the SARS V2, depending on which bit of literature you read, is obviously a new hazard, and that means a revision of workplace risk assessments. We're also starting to get clients asking us for support on risk assessments for coronavirus because their insurers are asking for that. So obviously there's a bit of nervousness in the insurance industry around making sure that their customers are protecting their workforce. So obviously it's a legal requirement to do a risk assessment, but I think, as I said at the bottom, I said last week, risk assessments have never been more important than they are now. It protects the business, it protects the staff, it makes sure that your key workers are not going off sick. I think though even more important is that we involve the employees within the risk assessment process. Now, this is a legal requirement anyway, and everybody should be doing that. I know in reality that's not the case in most places, or in many places rather. But it's key now that we do really get employees buying into the risk assessment process, and so that they're feeling like they are protected when they're at work. The stay-at-home message has, and the number of fatalities that we keep talking around, has really made people anxious about this virus. And if they don't believe that they're looked after at work, then that's going to cause all sorts of problems further down the line, which we'll talk about later. So it's really key that we get the employees engaged now, and that we talk to them and we make sure that they're convinced that as an employer we're looking after their safety. So do you want to move on to the next slide for us, Dan? So last night, late last night, and we're still ploughing through them, the government actually put out some new industry guidelines for various industry sectors. I had a quick run through them. Like I say, we're going through them in detail while I'm on the webinar. My guys are doing that and just making sure that we're up to date as much as we can be. But the key controls that come out of all of this government guidelines are let's prevent it coming into the workplace in the first place. So if somebody's got the symptoms, or somebody in their house has got symptoms, stay 14-day isolation or arrange the testing that's available. But basically, they stay at home until it's confirmed that they've not got the virus or that they're 14-day symptom-free. Where home working is possible, that still continues. Obviously, we're an office-based business, and my colleagues keep asking me when we're going to be back in the office. My honest answer is I don't know. So if you are home working at the moment, in an office-based situation, expect to be home working for at least until the end of July, August, probably even into September, October. Where people travel to work, review that, because obviously there's a risk of infection and bringing that into the workplace. Try avoiding public transport, reduce car sharing unless obviously they're from the same household. Where you can, encourage cycling to work. Don't forget there are benefit schemes out there which can help employees and employers put cycling to work schemes in place. Face coverings are now recommended, but the face covering recommendation is not personal protective equipment. The requirement to wear a face covering is so that the wearer, when they sneeze, it doesn't spread viruses around the workplace or around the public area. It is just to catch any sneezing or coughing. So if you remember, the guidance that came out originally back in March was to sneeze or cough into your elbow. So we've taken that stage further now, and we're saying wear a face covering so that catches the sneeze and it doesn't spread the virus or any other virus around the area that person, that the wearer of the face covering is in. It is not there to protect the employee wearing the mask or the face covering from viruses that are already in the atmosphere. That needs proper personal protective equipment, and that's why the NHS are swallowing up all the supplies of P3 masks at the moment. The other control when we're in the workplace is social distancing. Spread your staff out as much as possible, review shift patterns, reduce number of people in the shop floor, on the shop floor area, in the workshops. Restrict access to canteens, depending on the size of the canteen, so that you've only got 1-2 people in there at a time, depending on how big it is and whether you can keep them 2 meters apart. Where social distancing can't be implemented, it may be that you have some heavy equipment to move around. It needs 2 people to move that. Obviously, risk assess those individually. Can the task be avoided? Can it be left till later? Do you need to do it now? Can you automate it? And then another key control is ventilation. And again, I'm just calling out at the bottom of the slide. Obviously, I'm talking here in the main about the guidelines in England. They are UK-wide guidelines, but we do have to be aware that the stay-home message is a little bit stronger in Scotland, Northern Ireland, Wales. So again, just be aware of those local variations, and they may affect how you plan on your returning to work. Want to jump on to the next slide for us, Dan, please? When we talk about going back into a workplace, it's not as easy as just going in, turning the lights on, and everybody sitting down and carrying on with the work. The buildings potentially have been locked up for 6, 8, 12, 15, 20 weeks, depending on when we're going back in this phase release. So we need to consider other things like building safety. Fire alarms, are they still working? Water management, did we switch the hot water off? Does that mean Legionella bacteria maybe you're producing within the system? Do we need to flush it through? Do we need to turn the heating on for a day before we go back? Have we got asbestos in the building? Could that have been damaged? Fortunately, at the moment, we've not had any bad weather, so the chances of asbestos cement sheets on roofs being blown off is low, but it's always just worth that check. Do we need a deep clean? Yes or no? Most likely to be no, because the virus only survives for 72 hours. So if you've been out of the building for weeks, then there'll be no virus there. But we might need to do a deep clean to satisfy some staff anxiety, some staff concerns. So there's a lot to think around about cleaning. Plant and equipment. What startup procedures do we need to put in place? Do we need to make sure pressure systems are checked? Do we need to make sure power press guardings all correct and checked before we go back into the workplace? Have we got any staff shortages? Do we need to retrain staff? If we're spreading shift patterns out, do we have enough supervisors who are trained and competent to supervise a 2 or 3 shift working pattern? Well, we've got staff with personal emergency evacuation plans, so people that might need to using an evacuation chair to come down several flights of stairs in a fire. Do we still have the right number of trained people in the building? Is that person still working in the right place? So there's lots of things around and about going back to work that we need to consider, not just around coronavirus. But the last one on there is sort of I put in there is employee well-being. There's a lot of webinars going on, not only in the health and safety, but in the employment law, HR professional arenas around well-being. There is a real push and a real need and a real concern about making sure that we don't put people's mental health at risk from bringing them back into a place where they're feeling anxious about going to. So it's a real big consideration about looking after your people. Remember, outside of potential business property costs, your people are probably the biggest investment you have in your business. So we need to obviously make sure that we're looking after that investment and that we're making sure it's looked after and it carries on performing and working to the best of their ability. So really focus on making sure people are feeling safe and not anxious about coming back into work. Stick on the next slide, Dan. Just as a quick one here. So what is the enforcement position on coronavirus? So back in April, the HSE, TUC, CBI put out a joint statement which basically said where businesses are safe to open, they should open. They shouldn't be forced to close because the guidelines are misinterpreted, etc. But in there was another paragraph, which is I've just put on the screen, and that is that where the HSE believe that Public Health England guidance is not being followed, so we've not got social distancing measures in place, they will take action. That on the statement is ranging from just coming in and giving advice, but remember the HSE charge you £154 an hour for giving that advice. But also potentially could be enforcement actions such as improvement notices or a prohibition notice. Effectively, a prohibition notice would shut the business down for a week, 2 weeks, while you implemented the safe systems that the HSE are suggesting. So again, there's loads of guidance out there. We're starting to see this COVID secure being mentioned, and what we're showing on the screen there is just like a certificate that an employee can use. Part of bringing the well-being and the reducing anxiety with the workforce, an employer can actually sign that, issue it to staff, and say, look, we're committed to making sure you're safe while you're at work. These are the steps that we're taking, and here's my signature to say that I'm willing to take those and make sure they're implemented. So whistle stop tour, there's a lot to talk about. I mean, I could carry on going and you'd still be here at lunchtime, but I know we need to obviously move the webinar on. So we'll move over to Audrey and then on to questions, I believe.
Thanks very much, Phil. Good morning, everybody. So yes, employees are going to be needing, as Phil said, really clear communication at all stages, because everyone really is going to be feeling quite unconfident about returning. So really clear communication information on an ongoing basis to manage that. It's probably worth just mentioning that employees do have a specific legal right under the Employment Rights Act to leave work if they believe their safety is threatened in any way. So there's, some potential for possible disputes arising if people are not sure what's going on, and you're all going to need to work together to try and avoid that and make sure that that situation doesn't arise. It's worth saying as well that the ability to go back to work is about the employee's situation as well as the employer's. So the rules say if people cannot work from home, they should go to work if possible. That doesn't just mean if their place of work reopens. It could mean, for example, if someone has school-aged children at home or they are unable to avoid safe public transport, then they can't go to work. The Prime Minister addressed this specific point yesterday in the House of Commons and said that employers must be relied upon to be reasonable and use common sense in bringing people back in. So if it's necessary to come into work, it's safe to come into work, and also if it's mutually agreed. So it's not just about opening up, but it's about looking at people's individual situations. And that leads on to, obviously, some employees may remain on furlough even as workplaces reopen. If you need a smaller workforce, perhaps in the short term, as you start up again, you may be able to arrange some returners and have some on furlough, perhaps on the basis of those who can't return, perhaps while schools are closed, for example. As Michelle mentioned earlier, we're expecting an update on furlough later on today from the Chancellor. Really interesting to see what he's going to say to manage that. Some of the suggestions are that the amount could be scaled back from 80%, or the scheme could be changed to give some kind of part-time support. There's some influential people, including the former Bank of England chief Mervyn King, and he was the one in charge during the 2008 banking crisis, has said actually that the furlough scheme should be extended until the economy recovers, which could be for months and months. So it'd be quite interesting to see whether that view starts to gain some traction as well. So watch this space, and maybe on to the next slide if we can, Dan. So just about what we can potentially do to help you in this situation. It's clear from what Phil said that this is the moment where a health and safety function of an organisation is right in the spotlight. It's really critical to get that bit right. What we're offering to our clients is a bit of a joined up approach here, where we can kind of bring together those HR pieces and the health and safety piece together to help walk you through all the bits you need to do. And as you can see from what Phil's been saying, it's endlessly complicated, and it's also true what he said, that there's an awful lot more to it that we've not got time to go through this morning. So obviously, if anybody is interested in talking to us about that, we can let you have some more information and help you build a safe working place that's safe for everyone who comes into it as well. Dan?
Okay, thank you, guys. Thank you, Audrey. So I think we're going to move over to some questions now. We've got one question. It's quite a long one. It's probably got a couple of questions in there, but it's all on the same theme. So I understand there is a new temporary law allowing employees to carry holiday over into 2021 and 2022. Does an employer have to allow it? If so, can we limit the amount of days they can carry over? Our contractors do not currently allow any carryover. Our staff have no reason to take holiday other than the fact that they are unable to physically go anywhere. Also, can we insist that they take a certain amount of holiday by a certain time in 2020? For example, ask them to take half their allowance by September. We don't want everyone to be struggling to fit in all their holiday by the end of the year. So it's probably a bit of a long one, but it is on the same or similar theme.
Well, to take the second part first, yes, subject to anything else that it might say in your contract of employment, you can request employees to take holiday, provided you give them sufficient notice to do so. Usually the minimum is twice as long as the holiday would be for. So 2 weeks notice of a requirement to take 1 week. So yes, you can ask employees to take some holiday before the end of this year. The intention of the legislation saying that you can carry holiday over statutory holiday into the next 2 holiday years is intended to help manage this situation. You can't really refuse to let people carry some of their holiday over because of that legislation. But it's important to have a bit of a dialogue and manage with your employees about what's right for the organisation as well as what's right for the individuals. It's worth noting as well that it's only statutory holiday that the government have said can be carried over, and in fact it's not quite all of that because of the way the law works. So it's actually up to 4 weeks. Anything in excess of that, you don't have to let anybody carry over.
Okay, thank you, Audrey. Another question we've got is holiday accrued on full pay or furloughed amount? Maybe a payroll question, and we can get one of our payroll teams to answer it post-webinar, but I don't know if we can answer that one on this call.
Yeah. It should be paid at 100%.
Right, okay, that's great. Probably one for you, Phil. Where employees cannot avoid using public transport to get to work, where does my responsibility lie regarding provision of PPE?
Under the Health and Safety at Work Act, they're not at work until they're at work. So there's actually no specific responsibility under there for providing PPE. I think obviously we're looking here more beyond what the Health and Safety at Work Act says, and it's a duty of care. If we're insisting they come to work as an employer, and we're insisting that they come to work knowing full well they've got to come on public transport, I think it's the right moral thing to do, to provide them with the face coverings that they might want. Now, remembering though that face coverings are not necessarily a guaranteed protection, and it might be worth looking at other ways, other people to come into work. Can they walk? Can they use a bike? Is public transport the right way? But I think we need to look now beyond just what the law says and what is the right thing to do for our people. At the end of the day, as I mentioned, they're our biggest resource. If we need them in work, we need them in work. So we need to look after them and make sure they can get there.
Okay. where employees need to travel together in a company van, should PPE be worn, particularly face coverings?
There's a lot of guidance out there on this at the moment, and it depends on the individual situations. Obviously, if it's two people from the same household, then probably not, because the risk's only the same as in the house. But my advice would be yes, so if it's two people from a different household and you've not got a screen, if it's like two people sat in a transit van next to each other on the front row, then yes, they probably should be wearing some kind of face covering. If they're sat in the back of a van, and that might be less of a risk. So it's a case again of looking at the type of vehicle that you've got. I do know that people like Currys and DFS and a lot of the big places where they need two people to go out and unload delivery, they're actually sending two vans out so that you don't have two people sat in the same van. So it may be that you look at avoiding two people going in the van, because remember, PPE and the wearing of face masks should be the last resort in any control hierarchy. So we should be looking at other ways of getting two people to the job without having to go in the car where that's possible.
Yeah, and just to kind of add on to that and back up what Phil said, that the piece that was in the government document yesterday very clearly said that face covering should be considered only when social distancing measures can't be in place or there's no other way around it. So it's very right that there's other considerations you need to give, but if you come to the conclusion that the only way you can get them to do their job is two people sat in close proximity, then that's when you need to look at the face coverings, and you must make sure that they're protected.
And it's probably worth, if that is a question from a client, then we'll probably get the health and safety advice line to get in touch later and just discuss that through in detail and see what the options are.
Okay, that's great. Another health and safety related one. Do we need to report our risk assessment results once completed to you or HSE before staff return to work?
No, there is no requirement. There's no change to legislation in that respect. It's like I say, your insurers might have a different view on that, but that's obviously a contractual view between your insurer and yourselves. So they may insist on seeing copies of your risk assessments. That's about risk reduction on their behalf. There's no requirement to send them to us. Obviously, we'll quite happily look at them and give some feedback, but there's no actual requirement to do so. There is, however, a legal requirement to make sure that they're communicated to your staff, and as we discussed earlier, to make sure that your staff are happy that they can work safely within those arrangements.
Okay, that's great. We'll do one more, because we've kind of got over time now, and we've got too many questions to get through. So I'll just pick another one. So Audrey just mentioned if employees cannot use safe public transport, then they cannot be expected to return to work. What do you mean by safe public transport? This is a concerning grey area for us.
I think it is a concerning grey area. So when the Prime Minister talked about this in the House of Commons yesterday, he specifically said that if employees can't get into work, then that would be a reason for them not to return to work. The guidance is that people should avoid public transport wherever they can. So there's a bit of a contradiction there, because because it's a contradiction. Public transport is opened, people are expected to go into work, but to avoid it at the same time. Phil, I don't know what your perspective on this might be, but it's a really difficult.
I was just going to jump in there.
Answer, yeah.
And this is part of the looking at your shift patterns. And obviously, if every employer in a town is working 9 while 5, then public transport is overloaded at 8:30. However, if you can change your shift patterns to start at 6 when public transport is less busy, then that might be a way of reducing the risk of people coming into work on public transport. The other one, which you might want to consider, especially if they're key staff, whether they've got a key role that nobody else in the business can control, is contracting a taxi company. And obviously there you can actually ask the taxi company what their controls are, how they're making sure the taxis are clean, and having the taxis bring those key people into the business, avoid them having to use buses and trains.
Okay, that's great. We have had a few questions on whether we're circulating the slides. This webinar has been recorded, so we'll be sharing the recording later today with everyone that's registered. We still have got a few questions that we've not got round to answering. What we will do is take them away, get answers to them, and come back to you with a response. We, as I mentioned at the start of the webinar, we're not sure what day our next one's going to be, whether it'll be next week or the week after. I think we're just waiting for the next few days to see what guidance is released as to whether we think we should do it next week or the week after. So please look out in your inbox for an invite either this week or next week. So thank you for registering today and joining, and hope you all have a great day. Thank you. Bye bye.